I'm Dr. Elizabeth Loader. I'm the Chief of the Division of Headache in the Department of Neurology at the Brigham and Women's Hospital. I'm a professor of neurology at Harvard Medical School, and I also run the research section of the British Medical Journal. If there's any group of people with headache that you can really help and whose lives you can make a difference in, it's some of the people in these underserved populations. We concern ourselves with advocating for, identifying the problems that are faced by, and just generally drawing attention to the problems of underserved populations when it comes to headache treatment. Two I can think of. First of all, we've collaborated as a section under the leadership of Dr. Larry Charleston IV to produce a paper about underserved populations. What are the problems? What are the barriers they face? What are some of the possible solutions? And of course, what is an underserved population? It really depends on how you look at it. So traditionally, we think of various racial and ethnic minorities as being underserved, people who are in lower socioeconomic strata, but we also think about men as being underserved, transgender people as being underserved. There are lots of ways in which people can be prevented from either accessing or making use of effective treatment for headaches. So we try to take a very broad view. And so the paper dealt with the barriers that might be faced, barriers to care, problems with accessing care, problems affording care, problems getting medication, prejudice that certain populations might face. In the emergency department, for example, we know that pain in African Americans is often taken less seriously and treated less aggressively. So that's one project that I'm very proud of because, of course, we want to draw attention to these problems. The other project that we've recently completed was a pre-course at last year's Scottsdale meeting where we presented a variety of information about different underserved populations and strategies that people could use. One of the most popular talks was about how to make effective use of an interpreter if you're dealing with a patient whose first language is not English. We also had a talk on underserved because they're overserved that dealt with VIPs, which is a paradoxical way of thinking about being underserved. And that was another popular talk. And then beyond that, we had a talk about the epidemiology of migraine and which populations suffer more from migraine or are more likely to experience migraine and which populations are less likely to receive treatment for it. One of the big projects of the American Migraine Foundation, for example, is to have a registry where they track patients longitudinally over time. It will give a lot of insight into treatments that are effective and other important information about migraine. But our section was talking about the challenges in making sure that underserved populations are captured in that registry because they may have very different treatment outcomes, they may have very different responses to certain kinds of treatments. But to the extent that putting information into that registry depends on the patient doing some of it, the goal for the registry is that a lot of the information will be entered by patients, which makes a lot of sense if you have patients who are savvy and can type or understand how computers work or can actually write and read English. And we think there are segments of the population where that's not true. So one of the things we decided today was that we're going to talk to the people who are setting up the registry and find out from them what their plans are to make sure that they capture information for some of these segments of the population.